Cardiovascular disease, often referred to as CVD, is a group of disorders that affect the heart and blood vessels. This includes the arteries, veins, and capillaries that transport blood throughout your body. These diseases are a leading cause of death worldwide, claiming millions of lives each year. Understanding cardiovascular disease is crucial for prevention, early detection, and effective treatment. CVD affects people of all ages, backgrounds, and ethnicities. It can manifest in various forms, each with its own set of causes, symptoms, and treatment options. The impact of CVD extends far beyond the individual, affecting families, communities, and healthcare systems globally. Despite its prevalence, there is hope. With increased awareness, lifestyle modifications, and advancements in medical treatments, we can significantly reduce the burden of CVD and improve heart health for all. Cardiovascular disease encompasses a range of conditions, each affecting the heart and blood vessels in different ways. Here are some of the most common types. Coronary artery disease, or CAD. This occurs when plaque builds up inside the coronary arteries, narrowing them and reducing blood flow to the heart muscle. Stroke. A stroke happens when blood flow to the brain is interrupted, either due to a blocked artery, known as an ischemic stroke, or a ruptured blood vessel, known as a hemorrhagic stroke. Heart failure. This condition develops when the heart can't pump blood effectively enough to meet the body's needs. Peripheral artery disease, or PAD, affects the arteries in the limbs, particularly the legs, reducing blood flow and potentially leading to pain, numbness, and even amputation. Aortic disease. This involves problems with the aorta, the large artery that carries blood from the heart to the rest of the body, and can include aneurysms and dissections. Each type of CVD presents unique challenges and requires specialized treatment approaches. Understanding the distinctions between these conditions is vital for accurate diagnosis and effective management. Several factors contribute to the development of cardiovascular disease. These risk factors can be categorized as either non-modifiable, meaning you cannot change them, or modifiable, meaning you have the power to influence them. Non-modifiable risk factors. Age. The risk of CVD increases with age. Gender. Men are generally at a higher risk than women, although this gap narrows after menopause. Family history. Having a close relative with CVD increases your risk. Race and ethnicity. Certain racial and ethnic groups, such as African Americans, have a higher risk of CVD. Modifiable risk factors. Smoking. Smoking damages blood vessels and increases the risk of blood clots. High blood pressure. High blood pressure puts extra strain on the heart and blood vessels. High cholesterol. High cholesterol contributes to plaque buildup in the arteries. Diabetes. Diabetes damages blood vessels and increases the risk of other CVD risk factors. Obesity. Obesity increases the risk of several CVD risk factors, including high blood pressure, high cholesterol, and diabetes. Physical inactivity. Lack of physical activity increases the risk of several CVD risk factors. Unhealthy diet. A diet high in saturated and trans fats, cholesterol, and sodium increases the risk of CVD. By understanding and addressing these risk factors, especially the modifiable ones, you can significantly reduce your chances of developing cardiovascular disease. Cardiovascular disease often develops gradually, and many people experience no symptoms in the early stages. However, as the condition progresses, certain warning signs may arise, signaling the need for immediate medical attention. Common symptoms of CVD include chest pain or discomfort. This can range from a dull ache to a crushing pressure, often radiating to the arms, jaw, neck, or back. Shortness of breath. Difficulty breathing, especially during physical activity, can indicate heart or lung problems. Fatigue, unexplained fatigue, even after adequate rest, can be a sign of CVD. Irregular heartbeat. A fluttering sensation in the chest or a racing heart can be a symptom of arrhythmia. Swelling in the legs, ankles, or feet. This can indicate heart failure or other circulatory problems. Dizziness or lightheadedness. These symptoms can be caused by a drop in blood pressure or an irregular heartbeat. It's crucial to remember that these symptoms can also indicate other health conditions. If you experience any of these warning signs, seek medical attention immediately to determine the cause and receive appropriate treatment. Unveiling the truth. Diagnosing cardiovascular disease. Diagnosing cardiovascular disease involves a comprehensive evaluation of your medical history, physical examination, and various diagnostic tests. These tests help healthcare professionals assess the health of your heart and blood vessels and identify any abnormalities. Common diagnostic methods for cardiovascular disease include electrocardiogram or ECG. This non-invasive test records the electrical activity of the heart and can detect irregular heart rhythms, heart attacks, and other heart problems. Echocardiogram. This ultrasound test uses sound waves to create images of the heart, allowing doctors to evaluate its structure and function. Stress test. This test evaluates the heart's response to exercise or medication, revealing any blockages or blood flow problems. Coronary angiography. This minimally invasive procedure uses X-rays and contrast dye to visualize the coronary arteries, identifying any blockages. Blood tests. Blood tests can measure cholesterol levels, blood sugar levels, and other markers of heart health. Early diagnosis is crucial for effective cardiovascular disease management. These diagnostic tools provide valuable insights into your cardiovascular system, guiding treatment decisions and improving long-term outcomes. Section 6. Empowering your health, preventing cardiovascular disease. While some risk factors for cardiovascular disease are beyond our control, many lifestyle modifications can significantly reduce your risk and improve your overall heart health. By adopting these healthy habits, you can empower yourself to live a longer, healthier life. Key prevention strategies include: quit smoking. Quitting smoking is the single most important thing you can do for your heart health. Manage blood pressure. Regularly monitor your blood pressure and take medication as prescribed. Control cholesterol. Maintain healthy cholesterol levels through diet, exercise, and medication if needed. Manage diabetes. If you have diabetes, keep your blood sugar levels under control. Maintain a healthy weight. Lose weight if you are overweight or obese. Engage in regular physical activity. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Eat a heart-healthy diet. Choose fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit alcohol consumption. If you drink alcohol, do so in moderation. Prevention is always better than cure. By making healthy choices and prioritizing your heart health, you can significantly reduce your risk of developing cardiovascular disease. Section 7. Fighting back. Treatment options for cardiovascular disease. Treatment for cardiovascular disease varies depending on the specific condition, its severity, and the individual patient's needs. Treatment plans often involve a combination of lifestyle modifications, medications, and medical procedures. Common treatment options for cardiovascular disease include medications. Medications can lower blood pressure, reduce cholesterol, control blood sugar, prevent blood clots, and manage heart rhythm problems. Angioplasty and stenting. These minimally invasive procedures open blocked arteries using a balloon and a stent to keep the artery open. Coronary artery bypass grafting, or KBG. This surgery creates a detour around blocked coronary arteries using a healthy blood vessel from another part of the body. Heart valve repair or replacement. Damaged heart valves can be repaired or replaced with artificial valves. Pacemakers and implantable cardioverter defibrillators, or ICDs. These devices regulate heart rhythm and can prevent sudden cardiac arrest. Advances in medical technology continue to improve treatment options for cardiovascular disease, offering new hope and improved outcomes for patients. Section 8. Your heart, your life. Taking charge of your cardiovascular health. Cardiovascular disease is a serious health concern, but it's not an insurmountable challenge. By understanding the risks, recognizing the symptoms, and adopting a proactive approach to heart health, you can significantly reduce your risk of developing cardiovascular disease and improve your overall well-being. Key takeaways. Cardiovascular disease is a leading cause of death, but many cases are preventable. Knowing your risk factors and making healthy lifestyle choices are crucial for prevention. Early detection and treatment are essential for managing cardiovascular disease effectively. Take control of your heart health by scheduling regular checkups, discussing your risk factors with your doctor, and making healthy choices every day. Remember, your heart health is in your hands. By taking charge of your health today, you can ensure a healthier, brighter future for yourself and your loved ones. Section 9. A final word. The future of cardiovascular disease prevention and treatment. The landscape of cardiovascular disease prevention and treatment is constantly evolving. Researchers are tirelessly working to develop new diagnostic tools, medications, and therapies to combat this global health concern. From advancements in gene editing to personalized medicine approaches, the future of cardiovascular disease management holds immense promise. While we eagerly anticipate these breakthroughs, remember that the most powerful weapon against cardiovascular disease remains within our grasp: a proactive approach to heart health. By embracing healthy habits, staying informed, and advocating for our own well-being, we can collectively strive towards a future where cardiovascular disease no longer poses a significant threat to our lives.